If you're only missing one tooth, why a dental implant over a traditional bridge?
That's a great question. When I started practicing about 30 years ago, before dental implants were really routinely done, I would routinely or very often grind down two perfectly good adjacent teeth so I could put a bridge over them that was cemented to replace the single missing tooth. Nowadays, we don't do that because there's a much better option. If you put a dental implant right into the space where the tooth is missing, then you don't have to adjust at all the adjacent teeth, you don't grind down perfectly healthy tooth structure, and you don't start a downward spiral, because once they're ground down, you can't put the tooth structure back, and it starts to actually, like I say, start this downward spiral.
How long does a bridge last? Like the manufacturer, what do they say?
You know, it varies, but I'll say 7 to, say, 20 years, as opposed to a dental implant, which can be a permanent solution. And it's like a do-over in Mother Nature, I tell people. You get that tooth back just the way it used to be before you lost it.
And pain, it's not a problem with just one implant.
No. When I call every patient after procedure's done, and it's very, very common for a patient to say to me, wow, I'm surprised, I'm shocked. And I've had this line said to me too, that they've had fillings that were worse than getting a dental implant.
So if one of your family members was just missing one tooth, would you always do an implant over a bridge?
I wouldn't.
Like always?
I wouldn't let a family member do a bridge. If the adjacent teeth are healthy and they have the option of doing a single tooth dental implant replacement, I wouldn't let them.
So what's more expensive, the implant or the bridge?
Up front, there might be a slight difference, not a huge difference in the dental implant, but in the long run, there's no doubt about it. The dental implant turns out to be less expensive because that bridge may last a good number of years, but it has to be replaced again. And maybe again. And keep in mind, every time you replace that bridge, you run the risk of needing more treatment on the support teeth. They may need root canals. They may wind up getting extracted. So you may start this process where it just becomes a bigger and bigger and bigger problem over the years. Whereas if you do just a single tooth implant, you get that tooth back like a do-over in Mother Nature, and you don't have to worry about the adjacent teeth.
So you think it prevents future tooth loss?
Without a doubt.